World Health Organization, International Agency for Research on Cancer, has released new figures on the growing global cancer burden. They reveal an alarming lack of funding to care for cancer patients around the world. Oncology hospitalist and social media creator Dr. Tiutan is here with us now to talk about this. Thanks for joining us.
Thanks for having me.
Hey.
All right, so the first question, Doctor, is explain to our viewers these disparities in healthcare when it comes specifically to access to cancer care.
Yeah, so I think first of all, detection is lower for those who live in less developed countries. We're finding less new cases being diagnosed and higher mortality rates in these countries as well. It comes down to access to high quality care. So in fact, one of the statistics in the report that was released showed that only 39% of the countries that were surveyed by the WHO provided coverage for basics in cancer management in their health benefits packages. Astounding, right? What was more disheartening for me to see actually was only 28% of the countries provided coverage for palliative medicine services. So what is palliative medicine? It's a specialty that focuses on symptom burden, symptom management for those with serious illnesses, physically, mentally, and emotionally. So what we're finding is that people who live in less developed countries are not only dying more from cancer, but they're also getting less adequate access to symptom management.
I think that's it's really good because, you know, as you know, with numbers, they can be confusing. You can make numbers look like whatever you want. And one of the interesting things that I saw in this study is that women in more developed countries are more likely to be diagnosed with cancer than women in less developed countries. But that's not necessarily because there's a higher cancer rate here.
Right.
It's because they're not getting those early diagnoses. And so women in less developed countries are more likely to die of cancer. They're being diagnosed when the cancer is more advanced.
Exactly.
But the other thing I thought was really interesting is that lung cancer tops the list around the country. Can we talk a little bit around the world, rather, around the world?
Because I would have, as somebody who's not studying this closely, my first thought would have been either breast cancer or prostate cancer.
Yeah, because that's what we hear about a lot here, but when you look at it globally, it's lung cancer.
Lung cancer, most common cause of cancer and most common cause of death worldwide from cancer. It comes down to one of the main issues is tobacco use. Asian countries, there's high rates of tobacco use, which is contributing, of course, to mortality.
Well, let me ask you this, Doctor. We talk about the access that folks in less developed countries have, the education that they receive when it comes to cancer, but do you see similarities in certain demographics of populations here in the United States? I'm specifically talking about the Black and brown communities population here in the U.S. I'm always saddened beyond belief when I see someone who dies of a cancer that is treatable. Like I'm thinking about Chadwick Boseman. I talk about him a lot because I'm in my 50s and I've been getting my prostate and what's the other one you're supposed to colon. I've been getting that checked since I was in my late 40s because you don't want to end up as a statistic like this. But it's shocking to me that even when you have means, you have a platform, you have access to whatever you want. In other words, you are not struggling. You still are finding yourself either unwilling or afraid to go to visit a doctor to get that screening before it's too late. Why is that?
There's so many. This is a very challenging topic. I mean, there's stigmas in healthcare, mistrust, misinformation in the media. There are so many different factors that play a role in why people choose to ignore their symptoms, choose to rationalize how they feel in their bodies, and choose not to get access or not to seek care.
But you know, what you bring up, unfortunately, we sort of got to wrap it up, but the other thing that you see with this WHO study is colorectal cancers are up, stomach cancers are up. We're talking about this whole sort of digestive tract, and we could probably talk about the way people's diets have changed around the planet.
Where's that happening, though? Because you always hear that the diets outside of the United States are better in not maybe developing countries.
More and more like Americans, and I know the doctor can speak to that.
Yeah, I mean, well, we think about the major risk factors: tobacco use, alcohol, and obesity. That's worldwide. But yes, especially in westernized countries, ultra-processed foods, processed meats, those are the kind of the wave of really literature that is suggesting the risk factors that are contributing to higher cancer rates, colorectal cancer especially.
Dr. Tiutan, thank you so much. Great seeing you.
Thank you so much. You too.